Ryan with the America Project, and we are in Phoenix, Arizona at AmFest, and joining me today is Tom Douglas. And Tom has a really unique cause that he's working towards right now, especially with regard to the health crisis at our southern border. Tom, it's clear we all know we have an invasion going on at our southern border. We have a humanitarian crisis, national security crisis. But what some people are overlooking is we've got a medical crisis going on at our southern border. So talk about what you are fighting and why.
Yeah, thank you so much for having me. You know, if you recall back in like 2021, when we had the COVID pandemic, if any of us American citizens left the country, we would have to show proof of vaccination for COVID vaccination to get back into the country. However, our border was completely open, and we had thousands of migrants crossing over daily that didn't have to show any proof of vaccination. So they were held to a different standard. It was complete hypocrisy. So I started joining groups like MITRE and the Vaccine Credential Initiative to see how could we possibly make a difference to help protect the taxpayers from this health and humanitarian crisis. And so
it's so true, and now it's not just the COVID, even though that kind of sparked a lot of people's attention to the hypocrisy, but now that we've got this influx of children, migrants, that are being absorbed into American schools, this is now becoming very personal to parents across the country like yourself. Talk about that angle.
Yeah, I mean, I have two young kids. I have a 12-year-old and a 9-year-old. And for me to put them into the public school system, I have to show proof of vaccination beyond COVID and flu, Tdap, measles, mumps, everything.
The whole thing.
Otherwise, they don't get to go to school. Now, the migrants are not held to that same standard, unfortunately. We got 9,000 migrants in the New York school system. None of them are vaccinated. So there's a mass hypocrisy. There's a lot more that we can do to keep our taxpayers safe.
So let's take your children's school district in particular. What's the status? Like, have you guys gone to the school board? I'm sure you have. And like, where does that fight stand to vaccinate those children?
Yeah, it's a requirement. They have to show proof of vaccination before the school starts in September.
No, I mean the migrants, the ones that are...
Right now it's hypocrisy. There's nothing that's being done.
Nothing.
So that's why, we're trying to do more at our southern border. Since the fourth quarter of 2021, we've been vaccinating and tracking all the migrants crossing over. We've initiated about 850,000 vaccinations for COVID and flu, but that's really just the surface. There's many more vaccinations that are required that all of us have had to be vaccinated to be part of our workforce, part of our communities, part of our school systems, and the migrants have not had to oblige by any of that whatsoever.
So would you say your mission is more to make sure that these migrant children and adults are vaccinated, or is the mission to say, well, if they don't have to be vaccinated, our children don't either?
No, I mean, if we have a completely open border like we have now, it's not always going to be like this, but right now it's an open border. The numbers are only going up each month. So if we have an open border, the least that we can do for this health and humanitarian crisis is just provide these necessary vaccinations for the migrants crossing over. Otherwise, we know they're bringing drugs, disease, COVID into our communities. It's affecting our schools and it's affecting the taxpayers. So for every minuscule dollar that we spend on vaccinations, we are saving our public health system at least $10. You look at what's happening right now in Yuma, at Yuma Regional Medical Center. Every bed is taken by migrants. So the taxpayers in Yuma have to travel hours away to get medical attention. And at the same time, it's not good for Yuma either. Yuma is over $20 million in the hole from taking care of these migrants. So the least that we can do for our public health system is just to provide these necessary vaccinations that all of us taxpayers are required to have. That's until our border is properly closed.
What are some of the communicable diseases that are coming across our border right now?
Well, obviously we know COVID and flu. We're seeing a lot more measles and mumps come across. For every dollar spent on measles vaccinations, we're saving public health system $13.50. So it's the least that we can do. if the border is open like it is, we need to initiate these necessary vaccinations to keep our taxpayers safe.
And Tom, you wrote an op-ed for the Washington Times just recently, December 11th, titled "Vaccinating Migrants is the Right Thing to Do. Healthcare Savings Would Be Enormous." So people definitely can check out this op-ed with the Washington Times to learn more. And then do you have a website or where people can learn more about your efforts and what you're doing?
Yeah, sure. They can go to universal.one. Online, and they can see the great work that we've been doing since the fourth quarter of 2021, and we're really looking to do a lot more. Our efforts have really just been focused on the bare minimum. We've been doing COVID and flu vaccinations. We haven't been doing measles, mumps, Tdap, diphtheria. There's a lot more that we can be doing. I can tell you, my son, he had to get all of those necessary vaccinations to be in school, not just COVID and flu. So there's a lot more that we can do.
Thank you for your time and thank you for everything you're doing.
Thanks for having me.
Appreciate it. Thanks.